I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Robert J. Havey, MD, Institute for Global Health, and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions and addresses the latest COVID headlines every Tuesday and Thursday here on the Havey Institute for Global Health Facebook page. And today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest COVID news through today, the 2nd of November. And we invite you to continue to submit your questions via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. And leading the discussion is again today is Sophie Wiskowski, who is our student research assistant with the Institute. Now, Sophie, I turn it over to you.
Thank you, Kristen. Hi, Dr. Murphy.
Morning.
So in the United States, 58.2% of the population is fully vaccinated, but we are seeing a slight increase in cases over the last couple of days with 72,000 average of a positive case. There has been a decline of 13% cases over the last 14 days, but as I just said, this is also being increased just a little bit. Hospitalizations and deaths have both gone down with 17% decrease in hospitalizations and 12% decrease in deaths. But there are a few select states that are seeing high increase in cases, such as Colorado and Arizona and California. Illinois now has, in the population of 65 and up, 90% fully vaccinated, but there's still 40% of the population that is not vaccinated. Now, here in Illinois, there is a decrease in cases. We are seeing 2,107 positive cases per day. What can you tell us a bit about this slight increase in cases that we're seeing, with this average over the last 14 days?
Well, the United States is geographically and population-wise a very big country. And we're very big and very spread out with our pockets of population. So it's encouraging to see that the numbers are going in the right direction. But if anybody thinks this is almost over, they're crazy, because it is not. Having 72,000 new cases per day in the United States is a tragedy. And we're having over 1,000 deaths still per day. This is like, airplanes full of people crashing. We still have like some 80-some patients in the hospital at Northwestern today. I mean, that's a big chunk of patients. So it's not gone, and we shouldn't let our guard down. And what's happening, unfortunately, is people are thinking, oh yeah, it's almost over. They're getting back to, behaving in a quote normal fashion. Believe me, normal is not here yet. We're not ready for normal. And that's why you have cases jumping up in places like Maine, Colorado, California. This is not a good sign, but at least it's being recognized and then dealt with to keep things get back on track to continue to decline. It's a very bad virus. It's very, very transmissible, and this is not over yet.
Yeah, and speaking of it not being over, for one of the big headlines that hit yesterday at 5 in the morning, COVID-19 deaths have now surpassed 5 million globally. What can you tell us about this really difficult number?
Well, 5 million globally, 740,000 in the United States. COVID is now the third leading cause of death after heart disease and stroke. And it came out of nowhere. We didn't have an infectious cause of death in this country for many, many years. It certainly is a tragedy. And if you look at what's happening around the world, it's the wealthy countries, United States, UK, EU, that have most of the cases, and only 1/8 of the population, but a half of the fatalities. What's going on here? Some countries now are doing better, and they're doing better because of the high vaccination rate. We started off great, and now we're the laggards. There's too many people that are unvaccinated in this country. So it's a very sad thing. And the United States is the leading country for number of cases and for the number of deaths. Take all that into consideration and multiply it at least times 2. And that's really what's going on, because there's so many underreported cases here in the United States, because early in the pandemic, not so much now. And in many other countries, especially the low and middle income countries, where it's difficult to even get a test, diagnosis gets mixed up with many other things. So yeah, no, it's a very sad day, especially since we do have the tools. If everybody got vaccinated, everybody who got sick got monoclonal antibodies or this new treatment from Merck or whatever company, and everybody just got diagnosed just like that, could walk around the corner and get a very inexpensive test to get diagnosed. You know, it would make a huge difference, and the pandemic would go away. It would go away.
It absolutely would.
But that's not the case. Yeah.
Speaking of the importance of vaccinations, with the awaiting of the FDA approval for children, why is it important to vaccinate your child? Tell us the importance of this.
Yeah, so children 5 to 11 are not eligible to take any vaccine as of this time. Well, of course, that schools, school buses, you know, those kids are active, they're mobile. 28 million of them. And although, you know, everyone says, oh, well, the kids don't get that sick. Okay, 80 in that age group, 5 to 11, 8,300 have been in the hospital so far, and 170 have died. That's not good. All right. I mean, a sick kid. I mean, who, you know, I mean, over 8,000 and 170 deaths. Some bells should really be going off here. COVID is bad. Kids get it. And who knows what the long-term complications are? We don't know yet. So, so preventing disease in that group, of course, is very important, but also as important is that 28 million people, children or people, are continuing the spread along with the unvaccinated adults. So, you know, they're just keeping things going. Now, you know, they keep it down to a dull roar if all the adults around them are vaccinated, but they're a big pool of potentially infected people, especially with this Delta variant, which is so highly contagious. So when the vaccine comes out, if those kids take it, that means all kids in school can be vaccinated and they can basically almost go back to normal. So, I mean, that it's going to be a huge, huge thing. And to get that group is going to be much more, it's going to be challenging, yes, but it's going to have to be different because you can't say, oh, go over to Walgreens and get your vaccine like you do to an adult, which is also, I think, at this stage of the pandemic is kind of weird. Why, you know, I'm telling patients to go to Walgreens or CVS to get their vaccine. I mean, it's great that they're giving the vaccine because people go to their pharmacy a lot more than they go to their hospital, and the pharmacies are everywhere. I mean, it's a very, very convenient thing. I don't take that away from them. But, you know, when you need to, with the kids, you can't do that. And you know, the parent has to be there and stuff. And so the way we deliver the vaccines has got to be different. It's got to come out of the doctor's offices and the medical clinics where the kids are. And then if the family is there, you know, if they're seeing the kid get vaccinated and they're not vaccinated or they need a booster, they should get theirs too. Like, why send them one place and send the kids to another place? So anyway, it's great that this approval is most likely going to happen this week, and it's going to really help a lot.
Yeah, definitely. And for the last headline, emergency vaccine rule for large employers will be issued in the coming days. What can you tell us about this mandate that it's going to affect over 100 million Americans?
Yeah, I was happy this story came forward today because I was wondering where we were with that whole thing, because I still keep hearing from people from big companies that we're having these meetings and nobody's vaccinated, or we don't know if anyone's vaccinated or whatever. Well, that's going to end this week. They've got over 100 employees. This is like 100, involves 100 million people. So this is a lot of people. You want to keep your job, you're going to get vaccinated. And these mandates will work because people are going to have to make a very hard decision. Because there's like nowhere where can they go? I mean, they can go to a smaller company, that's true. But you know, their work opportunities are really going to be limited. And this includes the police and fire departments, all the city workers, you know, every big company worker, you know, the big companies like Google and Facebook and stuff, they already put this in place. Many of the big companies have already, American Airlines, the Archdiocese of Chicago, you know, they already said, hey, we want to be safe. And they did it before this government regulation went into effect, or is going into effect this week. And what they're using in this this mandate is OSHA, the Occupational Safety and Health Administration, and because unvaccinated people are putting the coworkers at risk, not only themselves. This is public health, putting everyone at risk. It's not just you, it's everyone, because you're going to be the one that's going to infect them, whether they're vaccinated or not, although the rate is lower in the vaccinated. But this is going to make probably the biggest effect overall on the pandemic in the United States.
Yeah, definitely, especially because companies have to pay a huge price if they don't vaccinate employees. So they'll put a lot of pressure.
Well, I think actually most of the companies that I've been dealing with and have asked me questions, they want to do the right thing. They're afraid. They're afraid they're going to lose employees. They're afraid, they're not going to have enough workforce. But if everybody has to do it, where are these people going to go?
Absolutely. Absolutely. Now for some questions of the week. This is an individual who had a breakthrough case. If one was exposed on Friday/Saturday and started feeling sick on Tuesday and then tested positive on Friday, how long does one need to stay in quarantine, and when should the second test be taken?
Yeah, well, there's published CDC guidelines for this type of scenario. And the basic guideline is after you're infected, it's 14 days you're no longer infected. Now, whether or not you do any testing in between is somewhat optional. The PCR tests in particular are not that helpful because they can be positive when you're not infectious. So maybe some of the other tests might actually be more beneficial. But a lot of the quarantine guidelines that are followed are actually 10 days. This is if you're feeling well. You have to have recovered, and at a minimum of 10 days, maybe with a rapid test, an antigen test. And what we do at some schools, including my own, is at day 7. This is after exposure, though. This is not a person who's been sick. At day 7, if someone's been exposed and they don't, you're supposed to quarantine there too. If they have a negative molecular test, they can go back to school. So, but that's just an exposure. This is actually what we're talking about here is actually real disease. So it's basically, if you put all that together, it's going to be 10 days, get a rapid test, go back, you're out if you feel well.
And with the follow-up, can you tell us a bit about breakthrough cases and what you're seeing in vaccinated populations with breakthrough cases?
The breakthrough cases are typically milder, rarely result in hospitalization. The number of breakthrough cases actually is been estimated at 1 in 5,000 vaccinated people. So why do you hear about so many breakthrough cases? We hear a lot about breakthrough cases. And famous people have breakthrough cases. Jen Psaki, the press secretary, had a breakthrough case. This one, that one had a breakthrough case. That's because so many people have been vaccinated. We're close to 200 million people in the United States vaccinated. So, divide by 5,000 is like, you're going to get a lot of cases of people who are exposed, but it shows you how contagious this thing really is, even giving it to a vaccinated person. Fortunately, they don't get that sick. So that's the best news. But the breakthrough cases are milder, let's put it that way, and lives are saved because fewer people die. Now, if you have underlying heart disease or cancer, something that's affecting your immune system, even a breakthrough case can kill you. People can die from a breakthrough case. I don't want to minimize the potential bad effects of that. Yeah, that's the story with the breakthroughs. They're not as bad as the non-breakthrough cases, the real cases. The real cases are terrible. The people in the hospital now are mostly unvaccinated. They're younger because, as you mentioned, 90% of people in Illinois over 65, is it, Sophie, are vaccinated. So they're handling the whole thing pretty well. The older people, hey, they don't want to get sick. So, they had a high motivation to get vaccinated. So they're really protected. So who's in the hospital now? younger people. I mean, it's really tragic. I mean, to see these people so young in the hospital, it's terrible. Pregnant women that didn't get vaccinated. It's another group that needs to be vaccinated. Only 25% of pregnant women have taken the vaccine. They're afraid, even though there's piles of safety data that show that you can take this vaccine at any time of pregnancy and it's safe. Getting COVID is not safe.
Yeah, definitely. For our second question, looking for advice on her 20-year-old son. He was vaccinated in April with J&J and contracted COVID at the beginning of September. She was wondering if he should get a booster and which one should he get. He also does have bicuspid pulmonary valve, but is otherwise healthy and active.
Yeah, the J&J vaccine offers it's a good vaccine, but it's not a very good vaccine. So, you know, the mRNA vaccines are better. So the protection is lower. He broke through on the J&J vaccine. He definitely needs a booster. Plus, he's got a bicuspid valve that puts him at risk for aortic valve disease at some particular point in his life. And so I would say for him, the half dose Moderna booster would be the way to go. That has shown you get the highest antibody protection. Plus, he had the COVID, so he's got antibodies from that already. He's going to have a super response. And as far as the Moderna and myocarditis, there's actually very few cases of myocarditis, although he falls in that age group because he's so young. But myocarditis, although it's a bad side effect, it's very rare and rarely results in hospitalization, or there's a very low rate of hospitalization. And those dying from myocarditis, it's also extremely rare. And usually people have underlying compromised diseases in that particular situation. I mean, that's all terrible. If they're really concerned about that, take the Pfizer vaccine.
Absolutely. And for our third question, this person starts with, the pandemic seems to be winding down, although I know there is still a danger of infection even when you're vaccinated. Although I and all my household members are fully vaccinated, we have some friends and family members who are not vaccinated and they have no intention of getting vaccinated. Is there any way of them interacting safely? She does have an 83-year-old mother that lives with them, you know, dinner invitations, Thanksgiving, etc. Can they be indoors unmasked, and is that safe?
No, there's no way that this can be done safely at this particular point in the pandemic. I'm sorry. Indoor mixing without masks between vaccinated and unvaccinated is just a recipe for disaster. You get your 83-year-old mother. Is it worth it having dinner if she gets sick and dies from COVID, even if she's vaccinated? You know, 83-year-olds, you know, it's tougher for 83-year-olds. So this is unfortunately not a good idea. If you're going to do it, you should do it. You should have the people wear N95 masks and try to stay 3 to 6 feet away from them. It's a little tough at dinner time, but you can put them in another room, I suppose. But I mean, to me, it's just not worth it. I mean, the vaccines are out there. People can do it. Then you can mingle safely and not put your 83-year-old mother at risk. I mean, let's get with the program here. I mean, we've got to protect our friends and relatives.
Yeah, absolutely. And for our last question, this individual was diagnosed with Pancytopenia, and she's been unable to get clear directions from any doctor as to what vaccine she should take and how. Is there one she should take, and how should she take it in a safe setting?
Well, Pancytopenia is not a known side effect of any of the vaccines. That's one thing. Now, depending on exactly how her platelets are, whether she can get an intramuscular injection is the case. Now, the doctor can say that, but if this person got COVID, it would be really a challenge to take care of her with the Pancytopenia. So you've got to balance the risk and the benefit. I would say the slight risk is definitely worth it because this person's going to have a really hard time with COVID.
Right. Yeah, absolutely. Well, Dr. Murphy, those are all of our questions for today. Thank you very much.
Great. Thank you, Sophie.